Hello, I'm Dr. Khare, pediatrician from Mumbai. Today we'll consider the topic of strabismus, also known as squint, which is looking obliquely. Squint is fairly common in children as also in adults. It is particularly important in children to diagnose squint early because undiagnosed and untreated squint can lead to amblyopia. What is amblyopia? Amblyopia means loss of acuity of vision in the given eye. Why does that develop? Two things are important for development of proper vision. Number one and the most important is formation of a proper image on the retina, and then the cortical mechanism for fusion of the images. The cortical mechanism for the fusion of the images is usually matures by about 10 years or so. Therefore, a proper image formation on the retina up to year of 10 often does not give rise to, up to the year of 10 may give rise to what is known as amblyopia. So it is important that the retinal image is proper, especially in the early part of life before the age of 10 years or even much before that, 3 to 4 years. And it is important that if detected early and treated, amblyopia to a great extent can be prevented. Therefore, loss of vision in one or two eye can result from untreated strabismus, and that is the importance of diagnosing strabismus. If the child is brought for squint, what do we do? A child may be brought for squint by the parents where there is obviously inner deviation or inward deviation of the eye. Now, one of the tests to rule out true strabismus from apparent strabismus is corneal light reflex. In this, we stand at a distance of about 3 to 4 feet from the child and shine the torch in the pupil of the child's eyes and look for the image of the torch into the pupils. The image should be at a symmetrical position in both the eyes. There may be slight inward deviation into the pupil, but what is important is the image is symmetrical. This rules out an obvious squint in a given child. In a pseudo squint, where there is no squint, the image is at symmetrical position in both the eyes. While if there is a true squint, the image will not be symmetrical in both the eyes. Sometimes the image may be slightly inwards, but it is symmetrical. Then we consider this as a pseudo squint. It occurs as a result of depression of the nasal bridge, which ultimately develops normally, or in epicanthic fold, or the interpupillary distance is slightly less. So we use these tests for ruling out a pseudo squint from a true squint. What are these tests apart from corneal reflex? There are two tests, which is cover and uncover test and alternating covering test. In this, the child looks straight, and as the child is looking straight, we cover one eye and observe the movement of the other eye. Then we remove the cover and also observe the movement and do the same thing on the other eye. If both the eyes are aligned properly, after covering or uncovering, no movement of the uncovered eye takes place, and therefore we can say that there is no misalignment of the eyes and therefore no obvious squint. In the second test, we cover and uncover eyes rapidly and one after the other, and we see the movement of the eyes when we cover and uncover, and if there is no movement of the eye when we cover, then the same conclusion is drawn that this child does not have a true squint. So what we have seen is, we have seen a pseudo squint, and in pseudo squint we have seen the three tests to differentiate the pseudo squint from a true squint. Now, sometimes the children may be brought for intermittent symptoms, especially during the time of fatigue or illness or fever, and when we examine the patient, there is maybe no obvious squint. In that case, we have to distinguish between latent squint and constant squint, and for this the tests which we are described are useful. So if pseudo squint and latent squint is ruled out, what we have is a constant squint. Once constant squint is diagnosed, we divide a constant squint into two. One is paralytic and second is non-paralytic. In paralytic, the movement of the eyeballs in the direction of the muscle which is supplied by nerve is affected. For example, if sixth nerve is affected, the lateral deviation of the eyeball is affected. These children may require a proper neurological workup, including the central nervous system. Often some syndromes are associated with that. Sometimes birth asphyxia or perinatal problem also can give rise to a paralytic squint. If paralytic squint is ruled out, then what we have is non-paralytic or concomitant squint. Concomitant squint can be unilateral or intermittent. In unilateral squint, there is constant squint all the time, and that eye is deprived of vision throughout. In alternating squint, the eyeballs move from time to time in a symmetrical fashion, and therefore each eye gets an exposure to the external stimuli from time to time. In these cases, therefore, chances of getting amblyopia are much less as compared to those who have unilateral squint. So having ruled that out, then we have the convergent and the divergent squint, which are to be followed for development of amblyopia. So the treatment for this is to cover the eye which has non-amblyopic or which has a good vision, because when we cover the eye which has good vision, then the eye which has got decreased acuity of vision is continuously stimulated to think, and therefore the prevention of further falling of the vision the further deterioration of vision can be prevented. These children often require a further follow-up, and a surgery or no surgery is to be considered later on. In adults, the squint again has to be evaluated from whether it has been present earlier or it has developed recently. The squint has been present from early in time, then it has already been evaluated and treatment is started. For any occurrence of fresh squint in an eye, or for that matter even in a child, requires evaluation for neurological or ophthalmological disease. So here we now see the importance of squint, and to summarize, diagnosis of squint or strabismus is important to prevent amblyopia. To rule out pseudo squint is important. Then other cases of constant squint or intermittent squint are to be followed for further deterioration or improvement of the eyeballs, and will require treatment accordingly. Thank you very much.